When Pat arrived to my office, he was referred by Dr. Samir Turk, one of my colleagues from cardiology. And Dr. Samir Turk was worried about his abnormal stress test. And you can clearly see blockages, significant blockages. And he came to see me to discuss whether these blockages would be better served by a stent, something Dr. Turk would do, or better served by bypass surgery, which myself or one of my colleagues would do an open heart surgery.
The moment that I first realized something wasn't right with my heart is when they told me they thought I needed surgery. And that's when they said, I think we better do some more checking here. Something's not right.
Pat had a coronary artery bypass. The essence of the operation is to use some pieces of blood vessels as new pipes, and we hook one end of each new pipe to a place where there's a lot of blood flow, and we hook the other end of this blood vessel in such a way that we create a new pathway that goes around the blockage. And in his particular situation, the operation presented some specific challenges. Because of the poor quality of that vein's wall, it ruptured in his recovery process, which created a truly life-threatening situation for Pat.
My anxiousness in finding out what was wrong with my heart and what needed to be done was calmed by the knowledge that these physicians and staff had as to what they were going to do, how they were going to do it, what the outcome was going to be. The hardest part of my health surgery was waking up in ICU and finding out that I barely made it through surgery. I made the comment probably after 4 days in ICU that having these angels come into my room, still get emotional about it, and take care of me and fill every need that I have when I'm totally helpless and I can't do anything for myself. And that started with coming out of anesthesia. I'm deaf in one ear and have a hearing aid in the other, cochlear implant. I didn't have those on. I couldn't talk because I was intubated. Then when they wrote me notes so I could read what they were saying, I couldn't see because I wear readers. I didn't have those on. They knew what I needed without me saying it, and that was every member of the team. That's probably the first time in my life that I felt completely helpless, and they comforted me through that. The whole team did.
Seeing the difference that you make in somebody's life, it is one of the most profound satisfactions that I ever had and have in my life. And if anything, Pat's recovery is a living testimony of how humbling can be for a surgeon. One weakness of Pat's body silently threatened his life after the heart surgery. I think it's tremendously important that we can deliver this type of care as close as possible to the community while maintaining the same high standards of a heart center in this country.
Having this heart care at Trinity Health is extremely important because it's not just the city of Minot, but it's the catchment area around us. People have to travel a lot less if they can have care in this region. So it's extremely important to have a successful cardiovascular and thoracic surgery locally here in Minot.
Trinity Health Foundation means a lot to the community and the region, and it means a lot to Trinity Health. What the foundation provides is the ability for the organization to purchase equipment, to set up programs, to hire and train people so that our services in all areas can be provided to the entire region. People in the region that Trinity Health serves can be very confident that we have excellent heart health care.
Trinity Health, making more possible.